Good evening, everyone. I'm Dr. Vandana from South End, Senior Consultant, and I have with me my senior colleague, Dr. Sandeep Talwar from the same unit, and we are back again with another concern regarding fertility. We all know that an event in December of 2019 changed the entire world. It devastated the entire world, and the change was the new coronavirus, which we all know by the name of COVID-19. It just devastated everyone because on March 11th, it was declared as a pandemic and the entire world came to a standstill. Lives changed, living patterns changed, everything changed, everything was affected, and so were the medical practices. So much so that as the events unfolded, the elective non urgent surgeries and the IVF procedures got postponed and deferred. And this left the patients who were ready to go in for their IVF little depressed and dejected. But it was important because no one knew anything about that new virus at that time. There were so many deaths and fatalities that were happening around the world. And we had to take all the precautions that we could to avoid any kind of complications because patient safety is our prime concern. But the good news is that now the things are returning back and we are bouncing back, and the IVF units are opening, though with a reduced capacity. But as the patients are coming, we are still, bombarded with the same set of questions, and the questions are very important. And the most important one out of them is IVF safe during these times? This is a very important questions which everybody wants us to answer, and many more attached to them. So Dr. Sandeep, what's your take on it, and how do you explain this to the patients?
See, life, as Vandana very nicely, Dr. Vandana has told you, life has changed, but life is coming back to normal. And we have to see safety versus what is the patient's requirement or what is the patient's demand. So one has to balance both the things and then go forwards. So going forwards, the way is not to stop all the IVF treatment, but it is to do it with precautions. So I would just say one line: IVF is safe or ART is safe provided you have taken the due precautions which are to be taken in these extraordinary times, I would call them. So it is safe with precautions.
So definitely, I do agree because the information that is pouring in from the world, from the data that we have collected, and from all across the studies that are being done, that IVF is quite safe, properly, though only in if you are doing it following proper precautions, taking all the precautions, following the standard operating protocols and the current recommendations according to the national guidelines. Definitely, we can and we should not be refusing this procedure to our patients. But again, the basic concern of the patient remains: how is this treatment going to be different? Is this treatment going to be different nowadays than it was during earlier times when there was no COVID? Do you still feel the same, Dr. Sandeep?
No, the IVF treatment is different in the fact, in one aspect, which is not even only with IVF, with other consults also, that we are doing more and more teleconsultations. We
Right.
are first talking to the patients. You see, what we are trying to minimize is patients' unnecessary visits to the clinic. So,
Definitely.
whatever we can do on the video consults or Zoom calls or whatever, we are doing it so that the patient interaction in the clinic is exactly how much it is required. It should not be more than what it is required. So, the preliminary workup of the patient, which we would have ordinarily done in patients coming to the clinic, we are doing it on over Zoom calls or video consults and telling them what to do. You know, we are completely we are paperless, as to say that we are doing everything. We are doing the consults are teleconsults. We are telling person, we are making up prescriptions online, we are mailing. So patients care is not being compromised, treatment is
Correct.
not being compromised, Only thing we are doing is that we are trying to minimize the risk and take 100% precautions and following the standard operating procedures as they have been advised.
So definitely wearing masks, wearing gloves, and using the PPs as per the national guidelines. So we are all following that. But still, Dr. Talwar, do you think that you are prioritizing your patients, or the patient needs to be prioritized, or there are a few subset of patients who need to think that yes, they need to move forward now and they need to step out and get their treatment done? Is there any subset of patients you are looking at who needs to be prioritized?
See, there are people who already have diminished ovarian reserve or oocyte
Correct.
capacity.
I
Now,
agree.
these are something we call as poor responders. People who are elderly patients, people who've been just waiting. We all have subsets of patients who've been waiting for 6 months, 7 months, and they are not the ones who should have actually waited,
Right.
but things were in that kind of a framework of mind that you were wanting to wait. Or
Right.
patients who are, say, 40 years and above, who are wanting oocyte cryopreservation. They are the
Correct.
ones whose age is going forwards, the ovaries are not going to respond that well. They are the ones who should not be thinking, because whenever if we are doing something, we are taking 100% precautions and then doing a thing. Medically, we are responsible. So we are doing things with responsibility, but having said that, we have to balance your response also. If
Correct.
after 2 months your ovaries are not going to respond, then you're going to be nowhere.
Definitely.
So a
I
correct
agree that.
balance has to be struck. Yeah.
Yes, before it's too late, because I don't think so. And I think everybody thinks the same way, that Corona is not going to go completely, abruptly. It is not going to go off. It is going to still linger on. And for how much time, we can't say that. So we have to bounce back towards normalcy also. If we take step by step the IVF procedure and taking the patient's concerns along with it, so during the phase of the first phase of ovarian stimulation, what what extra precautions or what extra test or extra advice that you would like to give to the patient, or the patient should be knowing that okay, I'm going through an IVF treatment, now I need to do this.
So what we are doing is, on step one, when we are calling you, when we are going to start your treatment, before that we are doing your COVID test for you
Correct.
also and your partner also, because we want you to be safe, we want us to be safe, we want everybody to be safe. We don't
Definitely.
want you to be infected, neither we want anybody else to get infected. So that is one additional thing that we are doing, that we are getting you tested for, to start with. And going forwards, again, during the, when we are going to do the pickup, even before that we are, when we are going to give you the trigger injection, even then we are doing it, so that in that period of 8 days, 10 days, god forbid, unfortunately, you've not contracted that infection. So we are being as careful as we can by doing the testing twice, so that there
Yes.
is no risk at all of you being infected, or your, offspring, or the child being infected. That's the two tests that we are doing for you, your husband, is for your safety and for everybody else's safety.
And the most important question which we face every time, I'm sure Dr. Talwar, you must have also experienced, is after they get the initial COVID test done, the second thing they say, what if my second COVID comes out to be positive? Or even initially, what if I'm positive and I'm asymptomatic? What then? Would I still go ahead with the treatment, or my treatment stands cancelled?
No, when, if you, God forbid, you are positive, then we are not going to treat you. We are going to withhold this treatment. We are going to wait for 8 to 10 weeks, which is the recommended protocol, to wait for 10 weeks.
Correct.
Then we retest, and then the test we do is not your COVID RT-PCR. It is the antibody titer, to see that, how good is your body's immune response been to this disease. So then it comes to step two. But step one is, at that time, if you are positive, god forbid, then at that point of time we are going to withhold your treatment and see how well you are feeling. It's not only, we are not only IVF specialists, we are concerned about your general condition.
Correct.
So we would definitely want you to be quarantined at home follow the protocols which the government or the health ministry or the doctors have told you. Isolate yourself, see if you develop any symptoms, then you see a doctor. Otherwise, if you are symptomless, then please stay being quarantined, stay safe, retest, and then see if all is well. Then we can again resume treatment. There is nothing that the treatment cannot be resumed, but only after following these protocols can the treatment be resumed.
So basically, this is for the concern of the safety and in the better interest of the patient as well as the healthcare personals. And of course, whatever you've said, whatever advice is there, not to travel, not, to put into a relative isolation kind of a thing since your treatment is going on. So you, as the patients, also need to take these kind of advices and these kind of, they have to follow these recommendations while their treatment is going on in the interest of the patient. So once the pickup is done, ma'am, and then what about the embryo transfer? Would you recommend an embryo transfer during these times, or you would prefer that the patient, what options would you like to give to your patient?
We can do an embryo transfer. We don't have receptors for these COVID receptors. The receptors which are supposed to be present are not there on oocytes or embryos. So they are generally safe. Only if the freezing has to be done for some other indication. The
Correct.
patient has supernumerary embryos. We feel the patient is, that embryo transfer will not be good for the patient, or the success rate would be compromised. In those cases, we will do the freezing where it is not indicated to
Correct.
to transfer. But otherwise, if you fall into that category that embryo transfer can be done, we can do a transfer. Is there is no downside of doing the embryo transfer in these times as such.
So, in short, the message would be that yes, we can go ahead with the transfer, a fresh embryo transfer, if all the other parameters suggest us to do that, and that is in the interest of the patient. But in case we are, if there is any comorbid condition or anything of that sort, or the patient develops fever after the pickup or becomes a little symptomatic also, then of course we need to defer the embryo transfer and we need to freeze all the embryos, give the patient a break, and then move on. Am I right, ma'am?
Yes. So you only for the indications that freezing is indicated, or you would do embryo freezing. Those are the cases where you will not do the transfer. But in
Correct.
other cases, you will do the embryo transfer.
So another question that comes in the patient's mind is, what if I get a viral infection, or what if I get a COVID after the embryo transfer? We are we are caught from all the sides. So every step we are asked this question, we are bombarded with these questions. So the question is that after the embryo transfer, do what is the probability? I won't call the probability, but what if I get a COVID infection?
See, you really don't know that what is the effect of vertical transmission. It is too
Correct.
new. It is
Yes.
too new. It is a viral infection. End of the
Correct.
day, it's a viral infection. So how it's going to affect the neonate and what is going to happen is something which is a very very debatable issue. But having said that, you have to take precautions. But we'll have to weigh the possibilities of what is the chances, what is the viremia going to do. Those are certain risks uh, which could have a risk, and those so that is why we are very very when we are going to start the cycle at step 1, we'll say when you are starting the IVF cycle, please quarantine yourself.
Correct.
Please take utmost precautions, because this is what is going to save you for anything. If you have taken proper precautions, we are taking precautions. We are wearing our during procedures. We guys are wearing our PPE kits. We are wearing our face shields. We are wearing gloves. So we are taking utmost precautions. You also take utmost precautions, and that's the way to save you and your child.
So basically, we cannot give anybody that surety that the patient will definitely for sure not catch any infection during the embryo transfer, or for that matter, it can be other viral infections as well. And in viral infections, we do not know what is going to be the fate, what is the fever like, and other symptoms like. So we really can't be 100%. We can't guarantee there what is going to be the fate there, definitely. And As far as the vertical transmission is concerned, as far as the coronavirus is concerned, there are one or two odd case reports where the vertical transmission, where the neonate has been affected during pregnancy, during their delivery. But till now, there is no case report as such where the symptoms or the neonate has been, affected to a very severe degree. So basically, there also they say that even if the pregnant lady has got this COVID infection, they have done fairly well. But yes, after the embryo transfer, the scenario is very different because it's the period of organogenesis and everything. So the data is going to come probably after another 5 to 6 months, when the patients who have conceived during this time, they deliver, their data will tell us if what has happened to the patients or the neonates of those mothers who were COVID positive at during that time when they conceived. So that data will be probably more informative as to
Yes.
what would be the fate if the patient gets a COVID infection after the transfer.
So it
And
is
then,
very early. It is very early days to start commenting on this because, frankly speaking, we do not have data enough data for us to tell you what is the effect going to be on your child. What is the risk of vertical transmission? If it happens, what is the percentage of vertical transmission? Viruses are the things which takes long time to study. So it is going to maybe another 6 months. The Dr. Vandana very rightly said, after 6 months we may be wiser, and let's hope that we don't have to do this thing about COVID and we are all safe. But then
correct.
the data would be much more conclusive at that point of time.
Definitely, because if we correlate to their family of viruses, probably the data is quite heartening. If we see the other viruses of this family, the patients who have conceived are doing quite well. The neonates and the infants born to those mothers have been doing well. Now, the next question, if we have frozen the embryos for any XYZ reason, or for the patients whose embryos are already frozen with us, they are also concerned as to whether their gametes or whether their embryos are safe in these times, whether there is anything they have to worry about because of the corona.
See, when we are freezing the embryos, one thing which is to be very clearly understood by everybody is that we take a lot of precautions when we are doing cryopreservations. And there is the viruses, the embryos are not going to get your COVID infection while they are being stored. So, utmost precautions are done to make sure that all your embryos at all given points of time are safe. So, please don't be concerned that the embryos that we have maybe frozen pre COVID times are going to be infected because COVID has come. This is
Yes.
not going to happen. So, please remove these doubts from your mind, because we people, the lab people, the clinicians, are taking utmost precautions when they are doing the cryopreservation. So no chances of that. So please be relaxed.
Definitely. So we just to give you that surety, as Dr. Talwar have said, we have robust mechanisms in place. The teamwork is there. The lab personnel are very, very responsible, and they are taking care of your embryos, of your gametes in the best proper manner that they can, and that is quite reassuring that the embryos, nothing is going to happen to the gametes, to the embryos which have been frozen, because we are taking all the precautions, all the parameters that we can do according to the guidelines, so that there is no infection inside the lab. And for the pregnant patients, again, ma'am, for the pregnant patients, what does the data say? The patients who have delivered, who are going to, deliver, who are in the last trimester or anything, then where are they? What if they catch the infection, even if it is an IVF pregnancy?
So you will have to maybe do a cesarean section or take precautions when you are doing the deliveries. The obstetrician, see, you have to deliver the child. You have
Yes,
to deliver the child with precautions. So everything is you have to do your work, but you have to take proper precautions. For that, precautions have to be taken even for the doctors,
Correct.
because you are taking a chance by going and delivering a COVID patient. You,
Yes.
as doctors, we cannot shirk from our responsibility and say that no, we are not going to do it. We have to do it. But then we have to take our precautions. We have to put our systems in place so that we are also safe, the mother is safe, and the child is safe. So that is
And the
what you can
testimony,
do.
and basically I think the testimony to these factors, so many IVF pregnancies, our own IVF pregnancies have
Yes,
delivered this during
yes,
these 3 4 months. It was so heartening to
exactly,
see the pictures of the
exactly.
baby that the
Yeah,
patients shared with us, and it was so heartening to see the mother and the child doing well. And touch wood, with God's grace, none of the IVF pregnancies that have delivered, I mean, with us, have
yes.
had any such bad
We have not had
experience.
any problem. So we've had twin deliveries, we have had singleton deliveries in this
Yes.
time, and with God's grace, we have not had any problems with our IVF patients. Yes.
Yes, definitely. So, ma'am, thank you so much. I think that was quite heartening to know that IVF is definitely, we are looking forward to bouncing back, making the life return back to normal. And I'm sure we are all going towards that phase when things would be normal again and there would be nothing to fear about. But having said that, it is high time where people also should, the patients should also throw away their fears or get away with their fears and bounce back to normal, to start with their treatment in a more energetic and in a more enthusiastic manner without worrying about anything, but at the same time taking due precautions, following the standard operating protocols, whatever the clinic or whatever the hospitals guides them. And they should now start working towards achieving their dreams of parenthood. Thank you so much, Dr. Talwar, for being with us.
Thank
Thank
you.
you.
Thank
Thank
you.
you, everyone.
Have a great day. Stay
Thank you.
safe.